So I'll just jump to the basic idea of what we are doing right now. So just as Professor Miklos just talked about, this COVID-19 pandemic is not just making people suffering from getting the disease. It is impacting our society in many perspectives. For example, I think you might read the news that the Tokyo Olympics has been announced delayed for 1 year. And also for the last 3 weeks, there are more than 16 million US Americans have already filed for unemployment insurance. So you can see that there are a lot of macroeconomic perspectives that will be impacted by the pandemic. And also this pandemic development is a constantly moving, constantly changing situation. And so is the social effects that the pandemic brings. So that's why we are inspired by this dynamic situation, and we are using the idea of the so-called industrial dynamics to help us establish this model that you are viewing right now. So very briefly, background of this industrial dynamics. So this is founded by J. Forrest in MIT in 1961. And the idea is that a system will, so social behaviors will be described from a feedback system view. And in this dynamic system, a system condition provide the input to a decision process, which in turn will generate actions that will modify the system condition. So this actually is what I just discussed about the pandemic and the social effects that it will have. And the pandemic development and the social effects will be interact with each other all the time. And let me now go over how this dynamic model works. So it all starts with this population, the whole population. And if the population size is large, it will have a lot of population social context. Oh, and by the way, the red arrows in this model resembles for positive feedback, and then the blue arrows are negative feedbacks. So with more social context, there will be more COVID-19 infections. And here we use infections because we don't know, we have not touched, we have not talked about the test yet. So this is only the infection stage, and there will be more COVID-19 infections because of a lot of social context in the large population. And because there are more COVID-19 infections, then there will be more confirmed infections, ideally, if we have a sufficient test. And when we have a lot of confirmed infections, and there will be a lot of people that are in urgent need of hospital resources, which in turn will probably make the hospital resources crashed. So this is a negative feedback that we are talking about. More confirmed infections will make less available hospital resources. And with less available resources in hospital, there will be more deaths. And with more death numbers, the population size will be decreased by this pandemic. So this big loop is just what I discussed about the pandemic from a nutshell. And if we divide the COVID-19 infections into confirmed infections and unconfirmed infections because we were just discussing about the test. So if the test is not sufficient, meaning there are a lot of screening steps before you could even get tested, and with more COVID-19 infections, there will not only be a lot of confirmed infections, there will also be a lot of unconfirmed infections. Hence, there is the positive feedback between COVID-19 infections and unconfirmed infections. And with more unconfirmed infections, they are the patients that they have the virus, but they are not aware of it. So they will go back to their normal life and they will get more people infected from this virus. So here, the number 8 error is also a positive feedback. And with that in mind, we have a lot of unconfirmed infections. We have a lot of confirmed infections. With crashed hospital resources, they will all contribute to the death tolls. And I just want to mention that there is another group of people that will also contribute to the death tolls is that a lot of people that they have underlying conditions, underlying diseases, and they are the people that they go to for hospital help, seeking medical assistance regularly, or people with the cancer, they need to go to the hospital for get treatment. But because of the pandemic, the hospital resources is already crashed, or they are concentrated on helping COVID-19 patients. The people that they go to hospital regularly for their treatment will not get efficient treatment, and that will be a group that contribute to the death tolls in total. And if we see the situation optimistically, if we have if we have more than available hospital resources, there will be more recovered from the COVID-19. And if there are more recovered from COVID-19, there will be less COVID-19 infections existed. However, this is a very optimistic angle, and with this more recovery from COVID-19, the population size will go back to normal, or even go to higher than the pandemic happened. But
okay. Wenu, we need to move ahead. Can you just talk about arrow 15 and 20 and 13 in the public panic level?
Sure. Because right now the death toll is continuously growing, so the public panic level has been raised, and everyone is talking about it, and that makes the government has finally taken measures such as stay-at-home or shelter-in-place orders, and also they ask the small businesses, the non-essential businesses, to close, and that will eventually cut the population social contact. And however, that will also induce for more unemployment. And also because people are staying at home, the arrow 18 resembles that the lower social contacts will also introduce to more unemployment. And because there are more unemployment, people will be getting more panicked. And
okay, I'm going to have to stop you here. We could spend a class on this. Let me just say a couple of comments. Thank you very much for the help. I want to mention that I went to MIT as an MBA. This is 40 years ago. And Jay Forrester was there. I had the privilege to attend his classes. He was electrical engineer, and he was famous for developing core memory for computers as an electrical engineer. And then he applied these concepts of feedback and differential equations and these loops that Wenwu is showing into basically GM, and created this book called Industrial Dynamics. Later on in his life, he worked with Mayo Collins, retired Mayo Collins from Boston, and created a thing called urban dynamics. And then later on, one of his students, Dennis Meadows, worked with him and created a thing they called the Club of Rome and talked about limits of growth. It was like world dynamics. Basically, put a wave in the group, they would put a wave of, let's say, expansion of COVID infections and see what was the effect in the feedback effects. One thing that I wanted Wenwu to show here, and she did, is that these effects are very complex. And there is actually a paper I think is probably the most interesting thing I ever wrote of Jay Forrester, I ever read of Jay Forrester, which is called The Counterintuitive Nature of Social Systems. Counterintuitive nature of social systems. And one of the things, for example, we simulated Boston and the traffic in Boston. We realized, at least their results said, that you put more highways, you actually increase the traffic problem, not decrease it. Because people live farther and farther from the center of the city, people actually think commutes in terms of time, not a distance. Maybe a little bit of economic factor or distance too. And interestingly enough, that paper, which I cited over and over, was published in the Sloan Management Review or in the MIT magazine, I don't know which one, meaning not even an A journal, not even a B journal. And I thought probably the most insightful thing I ever read in anything of this type. One more comment, there is a System Dynamics Society, and they have meetings, and they are going to have a virtual meeting reasonably soon. Anyone that wants to listen in probably can. I don't think they'll charge money for that. I have been 20 years before since I looked at this, but I think system dynamics is one of the better ways to model this. And so I'm happy that Wenwu and Chichin are looking into this. Thank you very much, Wenwu. Any comments, guys?
Can I ask a question? Can you explain what 20 it means? Like why there's a negative impact on population size?
Oh, yes, this is actually a lot of studies I have done, and this is a prediction that I made after reading other studies after the pandemic. So as you know that there is H1N1 in 2009 and also Ebola in 2012. And after such pandemics, the birth rates are decreasing sharply after the pandemic. So this is a prediction that I made after reading all the papers about what pandemic are bringing afterwards.
Okay.
I had this, Jumi, I had the same reaction as you. I thought was strange that because we did when I taught this course in Brazil recently, we looked at unintended consequences, and one of the predictions of unintended consequences was increase in population because people stayed home, and this is based on the blackout in New York about 15 years ago, and the blackout basically they had a surge of births because people were home and didn't know what to do with themselves.
Yes, actually, Professor, I think that's the difference between the Sandy storm that used to sweep in New York. I think that a paper that I read mentioned that. So after like natural disasters, the birth rates will actually going up. But after like the health disease pandemic thing, the birth rates will be going down. So that we all call that disasters, but they have some difference.
So my comment here is that So when you make a assumption on 20, you looking at the long term of the situation, but it's just my thinking, but I think the unemployment is just temporarily situation because government issued the laws that giving the money to people who's unemployed, so that companies like small business like tends to close their business and let their employee to get the unemployment payments from the insurance. So didn't you think that that's just like temporarily I don't know, just like situations just
A
temporarily
temporary
happen?
effect.
Yes, temporarily.
I wouldn't call it temporarily. I would use a short window. I think that would be more appropriate to say, because although people are filing for unemployment insurances, I don't think that would give the equal quality of security as people having a job.
Okay, I want to move ahead with this, but I want to do some concluding works on this. I think that concluding talk about this. I think that what the system dynamics thing was industrial dynamics, then became other dynamics, and system, except now they call it system dynamics, gives you an interesting insight, which applies to business systems and accounting and etc. Is that there is a lot of feedback loops that have unintended consequences or counterintuitive effects. And this is something that if we can model, we'll have much more insight. So let's see what happens. Will be very interesting to try to monitor. Hanchi, would
Can
you
I
like
ask
to
a
say?
question?
Sure.
So I really like this model because it gives you a big picture of what's going on in the relationship between different elements. But I'm wondering, I think that if I'm not sure how this will be applied in the real, let's say, government policy making practices, because because in this situation we want to do some forward-looking policy making, right? For example, making decisions about when to stop social distancing and such. But this model seems to be still retrospective, not prospective, because we know that there are many factors that are in this dynamic model, and there are some like negative or positive relationships. I'm thinking that like how to make this model a forward-looking instead. I'm not sure what I'm talking about, but I guess what I want to ask is how to use this model in the real situation that we are facing right now. But it's a really nice construct.
Abby, actually, this is, I think, is a forward-looking model. You put a wave in a particular place, like create a pandemic, and then you see what's the effect and the feedback effects, and then you change the shape of the wave, and you see how the other things, put a step function in there, see what's the effect of the step function. So I think that it is a forward-looking model.